Good afternoon and welcome to today's web seminar. We're going to pause for a second, let people join, and then we'll start the webinar. Welcome again to today's web seminar. We're going to give people just maybe one more minute to join. Maybe people are coming from eating lunch. We'll give them just another minute and we'll get started. All right, I think we're at 1:02 here. Let's dive in. So good afternoon. Welcome to our web seminar. This is Building Community Capacity and Compliance, and we'll be sharing findings and recommendations from a reproductive and sexual health learning community for short-term residential therapeutic programs. Next slide, please. We'll be holding a question and answer session at the end of the webinar, as we always do. So please do not hesitate to send us your questions at any point starting now throughout the webinar, and we'll get to as many questions as possible during the Q&A at the end. We're recording this web seminar, and we'll be posting that recording online along with these slides that you're seeing and any other information we promise you during the webinar. And that'll be posted on our website in our resource library. And we'll also send those out to everyone who registered today later this afternoon. Next slide, please. So we're going to start with welcoming our panelists. Then we'll share information about a learning community we convened of short-term residential therapeutic programs, or STRTPs, as we all call them. And this learning community was focused on reproductive and sexual health of the youth placed in their programs. So we are joined first by Anna Johnson, and Anna is the Senior Project Manager at John Burton Advocates for Youth and led the learning community that we'll be talking about today. Alyssa Miller is, excuse me, Program Manager at Hillsides, and Gina Effect is the Vice President of Sycamores. And these are both organizations that participated in the learning community and were have generously offered to join us today and share what they worked on and their experience. And these are both organizations that are located in Los Angeles County. Lastly, I'm Simone Turek-Lee, and I'm the Director of Housing and Health, also with John Burton Advocates for Youth. Okay, next slide. Thanks, Anna. So today we're sharing what we learned and what participants worked on over the course of the learning community, along with recommendations and, as I said, a Q&A. And all of the findings and the recommendations and information about what was included in the learning community, we have put all of that into a report. So we're releasing that today. And I believe Anna is putting a link to the report in the chat right now. So check that out, particularly if all of your questions are not answered or you want more information, it should all be there in that report. and you can get the full details there. It's available on our website. Next slide, please. So let's start with a brief overview of the learning community and really who participated in it. To provide some context here before we jump in, JBA's work on the reproductive and sexual health of foster youth is not solo work. This is work we've been conducting with a collaborative of other organizations across California. And we're part of a collective impact project called the Reproductive Health Equity Project for Foster Youth, or for short, we call it REP. REP brings together youth in foster care and the agencies that serve them to promote systems that normalize, support, and promote the bodily autonomy and healthy sexual development of youth in foster care. And while the focus of REP's work has been primarily, LA County focused, JBA's work is statewide, and so we do kind of this LA-based work and then also statewide work to achieve these goals, including working on state policy. This work, the work of REP, is funded by the Conrad and Hilton Foundation, and the backbone organization for this work is National Center for Youth Law, or NCYL. NCYL is joined by a collection of other organizations, including us, on what we call the leadership team, and you can see those organizations, their logos are on the screen. So this was a 15-month learning community. It had two main goals. The first one, improve compliance with the California Foster Youth Sexual Health Education Act, or SB 89, which passed in 2017. And a lot of the work of REP is implementing SB 89. Also to improve compliance with related community care licensing standards and really best practice. And then also to identify opportunities for policy change at the local and state levels. And we kind of hope in all of the work we do that those things are not happening in silos, that, as we are providing technical assistance and as we're working on implementing policy, we're also at the same time using those as vehicles to identify future policy. So these things happen definitely complementary. And these goals were met by delivering training and technical assistance primarily. And kind of before I talk about how the technical assistance was structured in the learning community, let's talk a little bit about who was in the learning community. That's a really important piece of this. So kind of early in 2020, we recruited 13 organizations that have short-term residential therapeutic programs, or like I said, STRTPs, which is a lot easier to say. They are collectively licensed to serve 521 children and youth, and that's 19%. Just to give you an idea, that's about 1 in 5 of the youth that are placed in STRTP statewide. They have these programs across 7 counties, and you'll see those on the next slide, those counties. And for those who aren't familiar with what an STRTP is, in a nutshell, this is a foster care placement specializing in intensive care and supervision of children and youth. And really, to be placed in an STRTP, a youth has to meet medical necessity criteria for Medi-Cal specialty mental health services, or have needs that can only be met by an STRTP with a specialized program. So youth tend to be placed in these placements that have really some of the greatest needs in our state. And so there are a lot of requirements around supervision and staff support, and that are not always present in other foster care placements. And these are congregate facilities. So under congregate care facilities, excuse me. So under continuum of care reform, we've phased out group homes and we've brought STRTPs on board. And so many group homes have actually transitioned to become STRTPs. And the reason we worked with these placements specifically in this learning community, one of the reasons is because, an STRTP, like I said, has unique kind of supervision requirements and a high level of supervision and safety precautions. And, it can be challenging to both ensure that a youth's reproductive and sexual health rights and needs are upheld, and then also meet those requirements. And so we know that this is a population that, we want to make sure that the folks serving them have the resources they need to be able to do that, and that they have the capacity to do that. And so that was really kind of what prompted this learning community. So this list here that you see on the screen is the list of the 13 organizations and what that participated and what counties they're in. And you can also see their licensed bed capacity. I want to take a moment just to acknowledge them all. What we haven't yet shared is that we launched this learning community in March 2020. And so if you were, living on planet Earth in March 2020, I'm sure you recall that this is when the COVID-19 pandemic really hit, and everyone kind of went inward, they went home. But not people who worked in these facilities. So, these youth had to be taken care of, and a lot had to happen for the young people that live in these facilities and the people who work in these facilities to stay safe and healthy. So first and foremost, I want to say thank you to everyone who's been working since last year to keep foster youth safe and cared for. And then also just to say, despite all this, these 13 organizations still participated in the learning community. So while they were scrambling to get protocols in place to cover shifts and everything else that was going on last year, they were also caring about the reproductive and sexual health rights of the young people they work with. So I really want to applaud people for that, and thank them for doing that. We can go to the next slide. So the learning community really covered 5 focus areas within reproductive and sexual health, and you can see those on the screen. It was really training, staff, confidentiality, mandated reporting, access to care and barrier removal, sexual health education, and then protecting youth from bias and discrimination. So we can go to, thank you, Anna. So across these focus areas, we delivered training and technical assistance with the goal of progress across those areas. I'm going to just summarize what that training and technical assistance consisted of. But first, I'll just say that, as we launched this at the start of the pandemic, as I said, and our intention initially when we were planning this project was to have a combination of in-person and remote activities. But as you can imagine, this ended up being 100% remote. So here's what we did. First, we conducted an assessment of policies and procedures. So we had each participant in the learning community take an organizational self-assessment to identify where they were starting across those 5 focus areas. Then we analyzed those assessment results to identify areas of strength and areas for improvement. And then we really made those areas for improvement the main focus of the learning community. And then at the close of the learning community, they took the same assessment to see the progress that had been achieved. And you can see in the report, in the appendix, there's a complete aggregate report of what the progress was, what the results of the assessments were. Next slide. So the second TA strategy we used was really developed what we consider a core practice model. We tend to do this for all of our learning communities, and then we really use that core practice model to guide where we want to land. So this one was called Key to Compliance, Reproductive and Sexual Health Policies and Practices for STRTPs. And you may have joined us for the webinar last year that we did in this publication, but if not, you can view the recording of that or check out the publication. Anna just put the link to the publication in the chat. Next slide. We also held convenings and trainings. So like I said, all these ended up being remote. So we held 9 online meetings for a total of 18 hours. We had specific focus in each one. Just an example, our first one, we focused on staff training. What were the onboarding and annual training protocols at each organization as far as the training they provide staff on reproductive and sexual health of youth? And then how do they maybe want to change those protocols during the learning community? Some of these online convenings were more of trainings delivered by subject matter experts to provide more in-depth content or connect the learning community participants to an existing resource. So we had 3 of those for a total of 6 hours. One example is we had foster care public health nurses, I think 5 or 6 actually, join the discussion and share kind of their role and then how they can be a resource in this kind of subject matter. And then what kind of regional examples of what that looks like where they are. And then also in the appendix of the report is a complete list of all these convenings if you want to see more about what each one focused on. Next slide. So lastly, we offered, individual technical assistance, and this really kind of pieced together all of the other things that we did. It was really the continuity between each meeting, right? So about 75 hours provided to 20 individuals across 13 organizations. This really was about having those tailored conversations about a program's specific goals. So Anna, delivered this by Zoom, phone, and email. We also offered 2 training curricula tailored for STRTPs to meet certain training mandates. These curricula were developed by the Reproductive Health Equity Project, and so we also hosted a webinar on them. And I guess we don't have a link to the webinar on those training curricula on the screen there, but you can always pull those from our resource library on our website. And then lastly, we offered 3 rosters. So this is something JBay likes to do. We like to develop rosters because we are often in a situation we find ourselves saying, wow, wouldn't it be great? Wouldn't it be easier? Wouldn't it be better to coordinate if we had a roster of, XYZ? And so we end up just creating those rosters. So this was a situation where we had 2 existing rosters of comprehensive sexual health education providers. And then we created a roster of the foster care public health nurses because that was expressed as kind of a need by learning community participants. So I am now going to turn it over to Anna Johnson. And again, Anna is the person at JBay who led this learning community and really delivered all of the technical assistance that I just talked about. So Anna's going to talk about what we learned from leading this learning community and really what the assessment results uncovered.
Thank you so much, Simone. And thank you everyone for joining us today. I was thrilled to see such interest in the topic, and I'm thrilled to be joined by our learning community partners today who put in so much work to understand the new changes in the laws, where they were at, and how to make sure that their day-to-day operations were aligning with a lot of new rights that foster youth have in the last 5 to 10 years that required a number of updates. So I'll share those updates with you and kind of what we found and where we went with those findings. So first, participants made considerable progress with their annual reproductive and sexual health training. So with that baseline assessment that Simone talked about, there's kind of 44% of organizations had some kind of annual training process in place for reproductive sexual health. And by the end of the learning community, 100% of organizations did. And in practice, they felt either that it was a well or extremely well or very kind of well done practice at the beginning was just 22%, and then a lot more confidence in that practice at the end of the learning community. And how we got there was the staff at the organizations in our learning community combined online with live trainings from Planned Parenthood or other local trainers that had that content knowledge to come in and support staff with additional modules. Some trainers on commercially sexually exploited youth. They kind of took in some different subject matter experts to fill out that training. They updated their training calendars and staff scheduling. As some of you know, STRTPs have to have full supervision at all times of youth, which means staff work in shifts. So it's very hard to have a full day in service where all of your staff attend. So they kind of have to scope it all out. And then just documenting completion in staff files. This is what the county and state require in order to, when they get audited for STRTPs, to show we've trained our staff. So making sure that the available trainings provided that type of documentation that organizations could show their progress. The next finding was that participants required additional training materials beyond the scope of what was currently available. There were some online and classroom trainings, but it was more for everyone about foster youth reproductive sexual health. And so it was tailored to social workers or resource families, but not necessarily to short-term residential therapeutic programs. So what the staff in our learning community said is we would love to see additional training modules like model conversations between youth and adults for how to have appropriate conversations about reproductive sexual health. Topics like STIs, birth control, safe sex, consent, healthy relationships, needing stronger trainings around LGBTQ, gender affirming care, or how to become an STRTP safe zone were things that they requested. There are some STRTPs that serve expectant and parenting youth, and they just wanted to know more about trauma-informed care, or some things around financial services or availability and referral to services for prenatal, postnatal care, and things like that, just understanding the field better, and then working with youth who have been commercially or sexually exploited. The next finding was that participants adopted policies to require sexual and reproductive health training for all new hires. So again, you'll see in this kind of graphic that at the start of the learning community, staff really said, we don't necessarily have a written policy or practice when we have a new hire come into our organization to let them know about the rights of youth, or our reproductive sexual health training might have been scheduled for December. This person got hired in January, so they might have to wait a whole year until that training pops up again. So what people did was they updated their onboarding process, they provided reading materials to new staff, and they used the online training curriculum that was put in the chat here as kind of you can complete this within the first month or so of your onboarding for our organization and get a certificate in your file that sort of lets new hires know the rights of youth from the beginning of their employment. So really great progress in that area. And that was made possible by those types of online curriculums that anyone could register for and take at their own pace. Los Angeles County has a training mandate that requires STRTPs contracted with them to complete 8 hours of annual training on reproductive and sexual health for youth in care. This mandate specifying the time was different than the state level mandate, which didn't specify how many hours. So there was also some confusion there about how do we get to 8 hours. The state training was maybe about 2.5 hours total. So there was kind of this gap of about 5.5 hours to get to that requirement. And so what organizations did, they talked to their audits and contracts managers. They asked for clarification about the different topics that would meet that requirement. They used the state trainings. They used the LA rep or the rep trainings that Simone mentioned. They got guest speakers to do video and recorded trainings from outside of the organization. And some even you'll hear about later when Alyssa shares what they did. They created an internal curriculum for supervisors to use. Around confidentiality law for reproductive sexual health rights, it's handled differently in California and for minors than in many states. And it's actually can sometimes be confusing to implement in practice. So some sensitive services are actually confidential, and a staff can only know about them if the youth chooses to disclose that information. And in order to really make that right a reality, staff took a little bit extra steps to improve their policy and practice here with securing filing cabinets and storage rooms in kind of separate areas, updating their rules. For everyone kind of has some new data systems as we move into this new technology age, and making sure that only certain people can see certain notes or certain appointment information, or how one person makes a note is really clear in the system. So they did steps like that around protocols, being really clear about who can see what and know which information when, and just really laying those protocols out. The next finding was that participants gained awareness about the importance and complexity of gender affirming care and other LGBTQ and sexual orientation, gender identity, and expression topics. So one of our guest speakers was actually the LGBT Center of Orange County, also Planned Parenthood of San Gabriel Valley. They joined our learning community for a special session, and they shared that they have available curriculums free to be able to train providers on things like LGBTQ 101, Trans 101 for transgender youth, SOGI 101, Safe Zone training, and they have these curriculum available. And so what STRTPs did was they reached out to those organizations and scheduled a training in service, or which during COVID is a video training, and also kind of plan that into their calendars. And this helped them meet some of the new rules and regulations around gender affirming care. Providers through that work also improved their use of preferred gender pronouns. So one of the rights of use that's clearly written out is that when you're in the home, everyone needs to refer to the youth by their preferred name and gender pronoun. And so that required some updating of policy and protocol for all staff to refer to young people correctly. There's a lot of practice of culture correction. If someone gets it wrong, uses the wrong name or pronoun, it's just about being reminded, oh, let's try that again. I'm going to use they this time. And also just holding conversations directly with supervisors, with staff, to make sure that they're in their reports and in everything, it's kind of consistent and that it's being honored. Participants significantly improved policies and procedures to help youth access routine reproductive and sexual health care. There seem to be some differences where routine appointments, as you'll see in the graphic here, started off fairly strongly as far as policy and practice. But when we'll talk about emergency appointments in a second. When emergencies come up and you might have staff responding to an emergency, who's going to take this youth to an appointment? Or if it's timely reproductive health care, things like pregnancy tests or counseling, things like gender affirming care and hormones, those are important to start and have services right away. If someone runs out of birth control, to go pick that up so there's not a gap, right? So these types of timely needs need to be met, and just balancing that out. Other staff you'll hear later updated their nursing protocols, so Alyssa will talk about that, and then collaborated with case managers and public health nurse to coordinate care, especially on when youth come into short-term programs and when they exit. The length of time is in law around a 6-month period for these programs. So you've got these handoffs on both ends with all of the clinical care and services that should be attended to. Providers reported challenges helping youth access that time-sensitive care and gender-affirming care in a timely manner, sometimes with COVID, because you might have more staff out who have been kind of exposed or waiting for a test to come back. And how organizations dealt with that was by reviewing safe alternative modes of transportation. So contracts with Hop, Skip, Drive, Lyft, Uber when staff couldn't take a youth. Sometimes youth had a preferred staff member who they would want to be the person driving them. And so kind of moving other staff around to make sure that that youth's preference could be honored. Updating protocols for when a youth discloses sensitive information to a single staff member was really important. If a young person trusts just you and you're on staff, but they don't want to tell anyone else yet, that's their right under the law to hold that information confidentially. So that means that person needs to know how to get that young person to services in a timely manner without also disclosing that until the youth is ready to disclose. There's certainly ways to have conversations about the benefits of sharing information with certain people, but it's kind of this fine line of you don't want to pressure a young person or making sure they get what they need. So this was part of that deeper conversation. Providers reported challenges helping youth access services following the disclosure of a pregnancy. Trained staff, like making sure that staff were directed, like how they would direct youth to pregnancy counseling and care without kind of putting any sort of personal bias or influence around a youth's right for how to make a decision in that moment. A lot of STRTPs updated their protocols and their clinic providers. LA Rep has worked with young people to vet local clinics and make sure that they are safe and trauma informed for working with youth in care. So there's nice clinic finders on our website if you want to check those out. And then they reviewed available services and financial supports for expectant and parenting youth. So for youth who do choose to be parents, to make sure they get into prenatal care and referred to services in a timely manner. Part of that was difficult because pregnancy was commonly results in placement change for the pregnant person. For if a young girl or someone in care becomes pregnant and that STRTP is not licensed to serve pregnant youth or parenting youth, there's a process to then change placements. And in that placement change, it becomes really important to coordinate with the case manager, the public health nurse, and providers to transition on both ends of that placement change, and to make sure that the youth's right to continue with their provider of choice is held in that transition, and that there's warm handoff. It's really stressful to move, and it's not necessarily, I don't think any public health official would say someone's pregnant, let's move their apartment. So this is where health best practices and stress reduction should be incorporated into, STRTP and child welfare laws. Providers made a lot of gains, as you'll see here, in helping youth access comprehensive sexual health education. This is a big part of Senate Bill 89, is making sure that youth receive that once in middle school and once in high school. And if they haven't gotten it through school, that they receive it through another provider. So the way that STRTPs really became a resource for child welfare workers at the time and schools was that they decided, we can provide access to free, reliable online information platforms that we discussed in a special learning community convening. Some that you'll hear about later arranged for providers to either come into the STRTP pre-COVID or during COVID online, kind of different sessions where youth could receive sexual health education. Or some groups referred youth to an online live sexual education class that REP had arranged with providers. So those came with some incentives, and they directed youth to that. So STRTPs really became this supportive player in coordinating access to education. Providers, STRTPs did express a need for additional content, better tracking, and the challenge specific to the pandemic with comprehensive sexual health education. There was limited entry due to COVID-19. So those outside providers who used to come in and work with youth on sexual health education couldn't come inside anymore. They had to adapt that classroom training to online. And it was also hard to tell if youth received their comprehensive sexual health education in school. This was a time of learning loss. Schools were moving online. Curriculums probably changed depending on how that school district provides that education. It would be hard to tell if a youth missed this. And so again, that was a challenge that was reported, and we'll look to these future years to kind of fill in the gaps that we know were part of this year of learning loss. And the final finding here is that some of the STRTPs in our learning community are religiously affiliated and have a religiously based missions, and staff that were participating from there reported additional challenges accessing comprehensive sexual health education and finding kind of a provider that didn't necessarily conflict with their organization's mission. And so we provided a list of providers and they could choose from those. They were referred, what the organization would do instead of having it inside the home was refer to a service for the youth to attend outside of the facility itself, or to identify subject matter experts on staff who could provide that service to the full within compliance to SB 89 rules and the California Healthy Youth Act. So those were all of the findings and things that came up and how we chose to handle it again in that COVID environment. So with that, I will let you actually now hear from the people who did those amazing practices and policies during this learning community and developed this out themselves. So our first speaker today is actually Alyssa Miller from Hillsides, which is in LA. And Alyssa is going to walk through 4 of the changes and kind of protocols that she updated during the learning community, and can take it from there. So Alyssa, I will hand it over to you.
Hi everyone, my name is Alyssa Miller from Hillside's STRTP in Pasadena. So I'm going to kind of go into detail about these 4 changes that I implemented and integrated into our STRTP. So the first is our staff training, and that actually started pre-COVID back in February 2020. We piloted the staff STRTP training with LA Rep, and those training materials became the basis for the training materials that I implemented within our department later. So we had about 15 to 20 managers a part of this LA Rep piloted training. And it was really just general information about SB 89, the youth rights, and how the supervisors and managers could start to implement some of these changes into the day-to-day work we do with the kiddos. And so with those training materials, I implemented 2 main things. I worked with our training department to create an online training to provide to all of our new staff during new hire orientation. So kind of like Anna previously mentioned, if someone's hired in January and we're only doing a yearly training, they might not get it for 6 months later. And so part of our new hire orientation within the first 3 weeks of being hired, we now provide this online training for them. And it is more general about, youth rights, what SB 89 is. And with that, I kind of went into more detail and created a 4-page training manual for our supervisors. And this is an example of just the first page of it. But it was a 4-page training manual on just the introduction of this bill that came about, the purpose of it, the objectives of the training. And what I really liked about this training is that instead of doing it online or in an auditorium with 200 people, we specifically chose to do it with managers and their 15 to 20 staff. So it was I'll try to speak a little louder. It was a much smaller group and very personalized. And with that, the staff and supervisors were able to do some role plays and really walk through some scenarios that came up or that clients brought to staff's attention. And so the feedback from that training was that supervisors really liked just how organized it was. And really at the end of it was about going through some real life scenarios and situations that could come about and how to have healthy conversations between staff and clients on these topics. I think the second topic, is everyone able to hear me? Okay, I'll keep going. Thanks, Simone. The second topic that we worked on was in regards to our collaboration with Planned Parenthood. For about 5 or 6 years now, actually, we have been working closely with Planned Parenthood. However, it has been somewhat inconsistent, and most of the sessions were about 4 or 5 sessions in total for each cottage. And with SB 89 and implementing more comprehensive sexual health education for our kiddos, we collaborated more closely with Planned Parenthood, and we're now having them come to each of our cottages, which are broken up by gender and age. And they're actually doing an 11-week curriculum. So this is the curriculum they walk through, going through values, anatomy, physiology. One new one that the clients loved was talking about social media and the impact of media, ending with self-care. So we really are excited to continue this with Planned Parenthood and increase that collaboration with them. The kids loved it. There were incentives involved. I think they even got money to participate, but it was all on Zoom, but there was a lot of participation. They were using the chat box, they were asking questions. So it was a really good experience we had with Planned Parenthood. And then the third change that I implemented was I worked really closely with Anna and held a lot of one-on-ones with her to start creating our youth rights protocols. And I had never written a protocol before or a policy. So that was a really great learning opportunity for me working with Anna. And we identified like what we didn't have. For example, we didn't have as much trainings. We were only maybe doing LGBTQ trainings. So we increased the trainings that we're doing. We identified other needs, such as asking social workers at intake, has this client had sexual health education in school, or is that something we need to follow up on? At intake, we now provide the youth rights brochures to our clients. And then the last thing that I'm about to speak about is our nursing form that we increased, kind of added more information on our nursing intake form. And we started making sure that we're asking all clients their pronouns, and we've really been working with staff on using the correct pronouns with all of our clients and how they identify. And then there's a section that we ask them if they want the youth rights brochure. We offer to go through it with them. We ask questions about like a sexual health interview. So do you know about safe sex? Have you been instructed on how to use a condom? And so just getting that information from the initial medical screening from our nursing department has been really helpful. So those are kind of the 4 changes that I implemented, from trainings to the youth rights protocol, to the Planned Parenthood collaboration, and then to this nursing intake medical screening. It was just a really amazing opportunity I had to be a part of this learning community and working with Simone and Anna. And I think a lot has been able to be implemented at Hillsides over the past year.
Thank you so much, Alyssa. It was a pleasure working with you. It was really nice to kind of see all of the protocols that Hillsides already had in place, and it wasn't so difficult to update it with the new changes in the law. So thank you so much, Alyssa. So next we have our next guest speaker, and this is Vice President from Sycamores, Gina Effect, who will talk to you about their work in the learning community and just in the field in general, as they've worked to ensure that youth reproductive sexual health rights are upheld, specific to the population that they serve and their programs and services array. So thank you, Gina, so much.
Thank you. It's a pleasure to be here. And I'm Gina. I'm Vice President of Permanency Services at Sycamores. We used to be called Halfway Sycamores. We rebranded recently, and I oversee in our STRTP 43 beds for boys ages 11 to 17 and non-minor dependents. Like Alyssa, it was a pleasure being part of the learning community, and it caused us to take a good look at every step sort of the treatment life, starting with admission and ending with discharge. We, like Hillsides, developed some new forms that we use during the intake process, and we really built up our nursing department to really take over that arm at intake. We have an on-site nursing department with 4 nurses, and they have just a really great level of expertise in supporting youth and are receptive, providing health and gender affirming healthcare. So each youth is given a copy of publication 490, which is Know Your Sexual and Reproductive Health Rights. And then we developed a sexual health questionnaire. It records youth's responses across a variety of questions. I'm more than happy to share that as well. And then we actually have a physical health form that we use in collaboration with our pediatrician. We developed it. It's a Staying Healthy questionnaire, and that includes a sexual health risk assessment. Concerns are identified at assessment, and they're addressed during the physical exam, confidentially between the pediatrician and the youth, and the nursing is onboarded as needed. Follow-ups, referrals, testing, and resources are provided at that time. We're very careful to use the correct language, gender affirming language. We take an individualized approach to all of our youth. We ask a lot of questions, and I think that's where we defer that SME status to the youth in determining what they need. We work closely with all children, all families, and we also have a training institute with some specific distinct knowledge base that we use to apply to this process as well. And then, of course, like most of you are using the CFT process as appropriate to determine ongoing care. And at discharge, we're assessing needs case by case and taking a good look at how we're linking and connecting in a sensitive way. Training was an area where we spent a lot of time developing, and like Hillside's worked closely with Planned Parenthood. And they provided all of our reproductive health trainings free of charge on site. And we did that in a 6-week consecutive 90-minute training schedule that we scheduled on our Wednesday in-services. So we were able to capture the majority of our daytime staff during that process. And we used a combination of live teams and then supplemented with some webinar-based trainings from a variety of websites that I can also share as well. Planned Parenthood was just so supportive of our staff's learning and comfort process. They were very sensitive to us and worked with some of our staff one-to-one. Some of our staff and some of our leaders weren't really aware of the consent laws and the requirements with regards to this topic. And there were some feelings about what we were being trained to speak to the youth about. And Planned Parenthood did a beautiful job in collaboration with our leadership and working with our team to be able to increase comfort zone around having some of those conversations, not only with the youth, but with staff. There was one team meeting in particular that stands out where there was a staff who was just not comfortable at all talking about consent and was very personally connected to the topic. And we were able to work with that staff to increase their comfort level. Planned Parenthood, they were able to come in and do a lot of early morning and evening trainings because our overnight staff needed that knowledge base as well. And we offered recordings of the trainings we couldn't provide in person. Just like Hillside's, we trained our staff on minor rights, contraceptives and pregnancy options, SOGI, cultural competency, building comfort around reproductive health, and then STIs. And then, like I referenced before, we used a variety of web-based trainings as well during COVID. It was instrumental, but we're going to be retaining a lot of this just because it's so efficient, combination of Teams, live training, and web-based. Then we also offered some youth groups, and those are 60 to 90 minutes in length. We did a bulk of those in March, right as we launched this training collaborative, and we trained on topics similar to those we trained staff on. SOGI, healthy relationships and consent, birth control methods, STIs, and then an introduction to Planned Parenthood services so our youth knew what they could obtain confidentially. One thing we're proud of that we spent some time doing is really working with staff one-to-one, which I referenced earlier. But even in the interview process, when we're bringing on staff, and we do this regarding other topics as well, we have parent partners who really guide the CFT process. And one of the questions we ask candidates, every candidate, no matter what their role is, what is your comfort in working with people with lived experience and having people with lived experience leading the case? We do the same thing with reproductive health topics. We're asking staff, we're role playing, we're really having transparent dialogue around their comfort level in being able to support youth around topics and strategies that they may not be personally aligned with. And that's okay. We're not wanting to change anybody's personal views, but we do need you to be aligned with our mission and values. So there's been a lot of dialogue and some concerted attempts at hire and in the interview process to support that. I'll finish by talking about our public health collaborative. As I'm sure many STRTPs have been up close and personal with public health in their jurisdiction. If you've had at least one outbreak, you've become very close to your public health department. Not only in supporting us during our COVID journey, but also in working with us in providing brochures, information. They've come in and trained our youth and staff as well. And we've also worked closely with public health and other stakeholders, CCL, out of home care, DCFS, on developing a better understanding and ability to document and justify harm reduction means, which I think are critical around this topic. And that is about all I have today. And I'm more than happy to share any information with anybody at any time and can put anything in the chat as needed.
Thank you so much, Gina and Alyssa, for sharing, you know, everything that you worked on, or maybe not even everything, but highlighting some of the things that you worked on and kind of giving us a window into that. And there has been some requests in the chat to, you know, for wanting to see if you all will share certain things. So I think we'll maybe follow up with you all about that and then see if we can circulate. But we're going to move into the recommendations section next. And, you know, these are really the things that we're drawing from our experience in the learning community, in talking with learning community participants and delivering technical assistance and training and looking at the findings. And so that's where these have grown out of. And they really, what we noticed is the recommendations really took on 3 themes. They mainly really pertained to training, kind of care coordination, or specifically to services for expectant and parenting youth. You know, although that's expectant and parenting youth are a small percentage of the young people in care or in STRTPs, there was a lot of discussion around how to manage and handle issues pertaining to expectant parenting youth. So we'll dive in and first talk about some recommendations related to training. Then I'll pass it off to Anna to go into the other kind of focus areas. So here with training, the first one is to require annual training on reproductive and sexual health for staff members at STRTPs and at transitional housing placements for non-minor dependents, or THP-NMD as we call placement. So as you may know, the California Foster Youth Sexual Health Education Act, or SB 89, required training of several parties, including social workers and probation officers, judges, resource families, and STRTP administrators. So what we'd like to see is this mandate expanded to include frontline staff members at STRTPs, and then also to reach THP-NMD. And the reason we'd really like to see it reach THP-NMD specifically is because these are the providers serving 18, 19, and 20-year-olds in care. And, you know, not surprisingly, this is the population that's having the most sex. This is out of all of, you know, age ranges, it's the oldest age range. There is the highest rate of pregnancy among youth who are non-minor dependents, not surprisingly. We're not going to expect to see that from the younger age brackets, but understandably, as people become young adults, this becomes more and more relevant. And so we certainly don't want to leave that placement out of the mix here. So we do want to see that mandate expanded. And we think it would be a good idea for the California Department of Social Services to issue guidance to kind of provide some clarity, should this mandate be expanded, on the number of hours and the training topics that would be considered as part of the training. And this has to do with, you know, during the learning community, finding that when this information is not clearly communicated, there can, you know, it can result in confusion at the local level. Another strategy, this isn't on the slide, but another strategy here, aside from a, you know, state requirement, would be for counties to require annual training in their contracts. And this is something that LA County currently does. And what we learned during the learning community is that this was certainly an effective strategy to get staff trained. You know, despite some of the hiccups that might exist in getting a mandate like this ramped up, you know, how many hours are the right number of hours, what training can be counted. At the end of the day, this is a great vehicle for ensuring that local providers are informed. And that's why, you know, LA has really prioritized this. So there's another kind of angle for that one. Next slide. So the next recommendation under training is to expand the existing California Social Work Education Center, or CalSWEC, training modules to cover additional topics. So STRTP staff expressed interest in several topics not currently covered in detail in the training curricula available through CalSWEC. And CalSWEC is the UC Berkeley department that develops training for social workers. So the topics of interest you can see are there on the screen that were requested most commonly. So STIs, birth control and safe sex, healthy relationships and consent, LGBTQ, trans, SOGI, gender affirming care and safe zone training, supporting expectant and parenting youth in foster care, and then working with commercially sexually exploited children and youth. So you can see these are not kind of generalized reproductive and sexual health 101, but these are all of the kind of subtopics that come up when you're covering, the full kind of breadth of what that what reproductive and sexual health covers. Next slide. So the next training recommendation is to require STRTP staff and administrators to complete LGBTQ, trans, SOGI, and safe zone training. So this is an area, learning community participants expressed interest in accessing training on these topics, and really believed that this training would improve their staff members' abilities to understand and really appropriately serve youth who identify as LGBTQ or who are gender nonconforming, and just to kind of bring us up to speed with where we are in 2021. This is an evolving topic. As we all know, things have changed a lot over the last several years as far as the information people have, the way people understand it. And so continuing to kind of bring up to speed what training material is out there, and then what is asked of people working with young people. So one way to do this would be for counties to include required training hours in their contracts on topics, on specific topics. So including that as a specified topic in that contract. Of course, alternately, an STRTP could implement this policy within their organization. So this could be something that individual STRTPs could adopt. And as you heard, some are doing this. Next slide. So this is the last training recommendation, and it's to develop and fund an online, live, or in-person comprehensive sexual health education training for foster youth. So this is recommendation to clarify. It's not about staff training, but really instead about kind of training or education for youth. SB 89 requires that a foster youth who missed comprehensive sexual health education in school receive it. So, the law requires that all youth receive sexual health education in school, but foster youth are more likely to miss it because the placement changes, school changes. So SB 89 requires that for all youth aged 10 or older, the county caseworker verify the youth has received it from their public school, once in middle school, once in high school. If the youth didn't receive the instruction, then the county has to make sure that they get it from an alternative source, or they get it from the school in a different way. So, these alternative sources can be difficult to find or to access or to get youth to attend. So, what came up a lot and what STRTPs communicated to us was that counties have communicated to them that it is difficult to fulfill this mandate. And so, STRTPs are sometimes asked or offered to help fulfill this mandate by arranging for sexual health education to be provided in the facility, in the home where youth live, or referring youth to local classes or online. So our recommendation here is to establish contracts with one or more sexual health education providers to really to provide, frequent, online, live, or in-person education for middle school, for high schoolers, and then for transition age youth. So having, age appropriate options that are accessible. Next slide.
Great. Well, thank you. Yeah.
Go ahead.
Thank you, Simone, for walking us through the training recommendations. So I'll continue with the care coordination recommendations that came up as part of the learning community. So Just as Simone was saying, it's hard to get that type of education because the California Healthy Youth Act implementation with school districts was difficult, and there's this need for alternative CSC classes. So one way to kind of help coordinate between school districts, case managers, and then the caregivers or STRTPs is to require schools to share a standardized form or communication with county case managers to confirm that that's happened, because there are some counties who have implemented these forms and it's kind of a clear process. Otherwise, what happens is, if I was a case manager, I'm trying to find the right person within that school, within that youth middle school. A youth might have gone to a number of middle schools, and I have to say, hey, this youth was there in 6th grade. Do you offer health class? Yes or no? Did they attend? Yes or no? And it can just be really time consuming. So the recommendation here is to kind of streamline that checks and balances. We are thinking, like, how do people do this efficiently? Because then where we want to see people spending the most time is actually aligning the service that's needed, aligning that class, and finding that alternative. Great. The next care coordination item is to let young people know, first of all, that they have a foster care public health nurse, what their nurse's name is, their role, their contact information. Both for minors and non-minor dependents, public health nurses can share educational resources. They help coordinate the youth's care and make sure that their wellness exams and certain components of their health care are updated in the health and education passport and other kind of critical features. So this can be a really important person in the youth's life if they know who they are. Now, foster care public health nurses are registered nurses. They do specialize across medical, dental, sexual and reproductive health, and mental health care. And some are specialized too. So there are some public health nurses who used to work in nurse-family partnership, and having them talk to an expectant or parenting youth is just kind of a no-brainer. It's like, this is someone who used to work in labor and delivery or used to work in a gynecological office and has all of that training. And so these kind of bridges and connections can give the youth a person that can really help them find care services and give them trusted information that, an STRTP staff member who's not a nurse might not also have that training or deep knowledge. Another way to kind of coordinate care with the public health nurse is to offer them as a resource to promote continuity of reproductive and sexual health service when the youth changes placement. So as we discussed, short-term residential therapeutic programs are intended sort of in the law to be a short-term placement. That's the ST part of the STRTP. And so at the front end, to manage that care and to uphold the rights of youth to maintain their current providers or doctors, have the doctors of choice, kind of have timely care, have confidential care, and make sure that on both ends and while in the home, those services are aligned. And for example, like if a youth is undergoing treatment for a sexually transmitted infection that has maybe 2 appointments, you don't want to just get one of the 2 because you haven't cleared that very curable issue, right? You need both. Or again, like I mentioned earlier with birth control, if it's going to run out, we need to get someone there. And there can be ways to coordinate that type of expertise. And then again, it's the youth's choice if they want to talk with their public health nurse or disclose any of that information, of course. But again, that type of coordination, the nurse can kind of explains things. If there's like a lab result, like they know what it means. They know what it says. They're trained in that. And so for the caregiver to understand, the STRTP staff to understand how important a follow-up appointment could be, they are the ones that are doing that interpretation. So now we'll move into the recommendations around serving expectant and parenting youth. Now, I know some of you are on the call from the STRTPs who are licensed to serve pregnant and parenting youth. So hello to you all. A lot of these recommendations came up from the conversations that we all had together. and from current changes under federal and state law that provide for some newer opportunities. So the first recommendation here is to mandate that expectant and parenting youth, including young fathers in care, be referred to specialized support and services, including home visiting programs. So home visiting programs means a nurse would enter the home of a pregnant or parenting youth and talk about kind of all of those milestones, or how to prepare for pregnancy and how to get the home ready so that it's safe and secure, and I'll answer a lot of questions about, breastfeeding or formula, or kind of swaddling and sleep, and all of these types of questions that can come up for a young person in care. So those programs have been researched and evidence-based to improve the health of both the pregnant parent, the mother, as well as the child. Now, federal law through the Families First Prevention and Services Act is going to provide a new opportunity for additional federal match of funds for these evidence-based parenting programs, and young people in care are automatically eligible for those services. The hook is that they have to be referred to the service in order to receive it, right? So having a kind of mandate that says at least you have to offer. Now it's up to the youth to decide if they do want to accept any kind of service. They can say, no, thank you, but it should be at least offered. And these local home visiting programs should be discussed, offered, and given that right, we have child and family team meetings. We have other kind of venues where conversations could be appropriate to kind of build in and think through a protocol there. Or to contract specifically, like some counties do have specific contracts to provide home visiting specific to youth in care. One recommended practice is actually a practice that is happening in some California counties. LA does have a specialized expectant parent youth conference, but the recommendation is to offer a specialized child and family team meeting that's convened once a young person discloses that they're pregnant, or once a young parent enters care, that care team coordinates and refers to the different financial programs, the different nutrition programs, the education and childcare programs that are available to expectant and parenting youth, and that care is coordinated. LA County has a great protocol. I know the people who have developed that protocol and who have helped to train others in how to use that protocol are actually on the webinar today. So thank you for that experience and best practice. And for youth who do accept the opportunity to participate in a CFT or an expectant and parenting youth conference, that's where these health appointments, services, referrals really start to happen and have led to some amazing outcomes for young parents in care. And the next recommendation, I think our final recommendation, if I'm counting right, is for services for expectant and parenting foster youth that pregnant youth can remain in their STRTP until a thorough transition plan is developed. So again, as I mentioned earlier, having abrupt change in your treatment or in your clinical provider or just moving is stressful. So we've all probably had to move at some point, and it's a disruption, and stress can affect a pregnancy. So having kind of a organized, supported transition plan can reduce that kind of prenatal stress and support the young person in having their care aligned. So what we recommend is that counties encourage their systems to coordinate and to kind of plan out that transition accordingly. And many STRTPs in our learning community were not contracted to serve pregnant and parenting youth, but potentially they could update their contracts and amend their plans of operation to include serving parenting youth if they do not already. So it's a consideration, to be able to maybe continue to serve a youth without moving them and having a placement change. Great. So those are recommendations that arose out of the learning community and came from our learning community members and from different opportunities in the field. And I do know we have a number of questions in the Q&A and some in the chat. So everyone, please drop in your questions now. We do have a considerable amount of time to answer those questions and to get our guest speakers back on the line here to talk through some of those. So we'll get started with the Q&A. So the first question is, how can community health educators and local organizations that offer comprehensive sexual health education help or support youth in foster care and STRTPs? I'm wondering if Gina or Alyssa, if you want to kind of re-highlight how you worked with Planned Parenthood and community health educators and what made that possible for you. I know you kind of touched on it, but I think Gina and Alyssa, if you want to just say, here's how working with Planned Parenthood, here's what they did, and here's why it worked for us.
Hi, everyone. So like I said, we have actually been collaborating with Planned Parenthood for about 5 or 6 years. So I would just recommend getting in contact with your local Planned Parenthood and finding out what opportunities they can provide, either trainings for staff or, like they did for us, programming for our clients. And we really prioritize the programming for the clients. So it used to be all in person, like 5 or 6 years ago, they'd come and hold sessions, again, based on age and gender. And then through COVID, everything became virtual. And they increased their curriculum to be from 6 sessions to 11 sessions. So I kind of would give them a heads up of like current challenges that were going on campus, or maybe periods where we had an increase in CSEC or an increase in other sexual behaviors going on, or clients really working through different identities, gender fluidity, and topics like that. So I'd kind of brief them on common topics going around our campus at certain times. But I would just recommend really getting in contact with your local Planned Parenthood. They've just been so easy to work with and always willing to engage. And I think overall the kids really do love it. They go as consistently as possible.
Mm-hmm. Thank you, Alyssa. And the flip side of that is, if you're a health provider on the line and want to be connected to better serve foster youth or to offer your educational programs, both the California Department of Social Services and the Community Care Licensing Division, they have some kind of emails that they can connect you. They have STRTP kind of registered lists and contacts. If you're trying to offer a certain program, we certainly could disseminate that out through those chains and networks if it was an appropriate service or offering. And JBay also has rosters of health education providers. So we have one for the federally funded PrEP and INE providers. And if you're a provider and you're not on there and you want to be added, let us know, we'll update it. And we have the Planned Parenthood affiliates roster on our website. So that makes it easy for people to find you and connect you from the foster care side. They can use those rosters to find their local Planned Parenthood or comprehensive sexual health provider.
And Anna, could I just add, just on the topics of rosters, if you're on the health educator side, you can also we have rosters of STRTPs and rosters of THP NMD and THP plus providers, so serving transition age youth, that you could use to reach out if you're offering a service, and it's organized by county. So if you're in a specific county, you could reach out to the local programs.
So I'll drop the program rosters into the chat in a second. I'll just pull it up on my computer here and drop it into the chat for you all. But I'll move on to the next question, which it says, curious if you know who would generally train social workers on SB 89. And that would be CalSWEC. It's an online curriculum and a classroom curriculum that's offered. And so you can go to the CDSS Healthy Sexual Development page, or to the CalSWEC website to find that training, or to find when the local classroom training might happen. I believe because of COVID, those have been a little bit more limited, but we also have a list of the SB 89 compliant training and a PDF of those on our website. So I can show you that there's one for judges in the courts, dependency attorneys, there's one tailored to social workers, there's one tailored to resource families, and now there's one tailored to STRTPs. So depending on who the audience is, there's a training for you.
And I think, Anna, if they're asking about who the trainer would be, maybe you want to, I mean, there's the regional training academies. It kind of depends what county you're in. It might be the regional training academy. Some work through FKCE, but it varies across counties on who is going to deliver the training.
Okay, great. So one attendee asked, are we able to get the information on the curriculum that Alyssa developed with Planned Parenthood, and how could we probably utilize this? So Alyssa, what advice do you have? Should we just connect people to the Planned Parenthood contact in their area? And, you know, maybe we can also refer them to like how you've already talked so much about how you developed that and what was coming up as topics of interest. So anything that you want to add?
Yeah, I mean, we can definitely try to find your local Planned Parenthood to connect you. And I can also ask our contact at San Gabriel Valley, because he may know and collaborate with other Planned Parenthoods throughout California.
Thank you. Great. And then Alyssa, we've also been asked if you're able to share the protocol set up at Hillside. So not to put you on the spot, but anyone that's looking for a similar protocol, what Alyssa and I did, we did a couple of one-on-one sessions over Zoom like this to look at the current practice and policy, and then to kind of fill in some of the blanks with new law. So I'll let Alyssa decide if that's a public document or not, but we certainly could help route you in the right direction to update any protocols for an organization.
Yeah, I would add that we've really looked at like what we're not doing or what maybe we have limited things on, like such as training. We did have some trainings, but it was limited. So I was just working with Anna on like, how can we expand this? How can we elaborate on certain topics? And then I started asking staff and supervisors, what do you think are the needs and what could help you? And created the protocol from there.
One of the fun parts of our conversation, I hope this is okay to share, Alyssa, was like thinking through just menstrual products and how they've changed over time. So now, even from the past like 4 or 5 years, you know, I think when I was trained, it was like, you can have a pad, you can have a tampon, maybe at a certain, you know, it was really restrictive. Now there's like underwear, cups, like there's all kind of different things. There's things for gender nonconforming people who menstruate, and there's just like a lot more to offer in terms of products these days, and young people have a choice in the products that they use and feel comfortable using. So we're also just living in a different world that's possible from when we might have or might have not received comprehensive sexual health education. The next question is about the intake form. Is that localized per agency or STRTP? So I believe that each intake protocol is developed by each STRTP. Their protocols are internal to that organization. And I haven't seen kind of a statewide recommended protocol yet, but as someone mentioned in the chat earlier, there is the licensing division does have a guide for residential therapeutic programs on different topics. And then there's also some contacts. And then like our guest today who updated their protocols, if you review the licensing standards or the key to compliance, which was the other publication we presented last year, it kind of summarizes the policies and protocols that would align an organization's procedures with current law and licensing standards. It's a checklist in the appendix you can go through. It could be a really good kind of checklist to just run it by your current protocols and see where there might be some places for additions. Let's see. If providers would like SOGI training, is there a local organization or group recommended that provides ongoing training? I'm wondering, Gina, are you still on? I'm wondering if you can talk about your certification and what that took, if you're still available.
Sure. We are actually all children's, all family, I'm going to say certified. Like we have a seal, meaning that we've satisfied some curriculum and some requirements toward that. And I can actually share that. I can send it to you and explain it. It's based on having the right policy and procedure in play, the right training protocol, things along those lines. And then there are some specific criteria that has to be met. We also have a training institute where we have that focus and specialty as well. So we always have that part of our cultural competency training series. We train on those topics 2 to 3 times per year, and we actually have coaching by one of our staff. But the ACAF certification process is a specific thing that I can share if I can send it to you, Anna, and then you can send it out to the group.
Sure. And then I know, Gina, you also have like a subject matter expert on staff. And I can also talk about the SOGI resources. And we have a list of LGBT centers. We have a list of the Planned Parenthood providers. They do have existing ready to go curriculum and trainers that will offer this to you for free. Like I said, LGBTQ, SOGI 101, Trans 101, Safe Zone training. As an educator, I took Safe Zone training for my classroom. These curriculums are available, but on top of that, outside providers, Gina, you all have an internal to staff subject matter expert.
We do. Dr. Nick Ryan is our go-to guy. And he provides the majority of our training, and he was the liaison with All Children, All Families.
Great, thanks, Gina.
Sure.
Right, so there's another question here is how do we identify and contact the public health nurse in our use area? So that's a great question. Simone, I think, just dropped it in the chat here for us, which is the foster care public health nurse roster. Now, this roster, we're kind of always updating. A lot of public health nurses were rerouted during COVID to frontline tracking, tracing, testing, response. And some of those positions have shifted. So if you're looking at this roster and we need to update it, please just let me know. But we have been maintaining a public health nurse roster. Some counties are smaller, so there's just 1 or 2 nurses there. It's easier to know who's who. And then other counties are larger. So you might want to ask, like, oh, I'm trying to find the right contact. The other thing is that the case manager, the social worker, probation officer, or the dependency attorney will also know who is assigned to that young person, who's on their team. So that's how, you can either ask a person on your team or you can use a roster. All right. So how much does the youth rights brochure cost? Great question. So I put into the chat that there are free brochures that you can order and have delivered to your STRTP provider facility, wherever you are, your classroom, your ILP office, depending on who you are. The Ombuds office has updated under AB 175 the rights brochures. There's now a coloring book. There's a guide. It's very youth-friendly. Youth were part of the development of that. It was vetted kind of statewide for clarity. And there's an order form on the Ombuds office website, fosteryouthhelp.org, foster youth resources, and there's an order form. So you just fill out that order form and those will be delivered right to you. Now, Alyssa, I don't know if you want to add anything about your protocol and how frequently you have needed to make some orders.
I've actually only made 2 orders in the past year. I've gotten hundreds of them. This is actually what they look like. And they're little pamphlets that we give to the clients at intake. And then nursing reviews it with them during intake as well.
Great. And Gina has provided to me the HRC website that guided their process for LGBTQ SOGI kind of certification and training. So let me get, or the training guide that they've used. So that's in the chat for you all. And thank you, Alyssa, and thank you, Gina. How can I receive a copy of staff training curriculum is one of the questions. So for STRTP staff, the curriculum that we mentioned, when we send the slides out, maybe I can actually just add the link to our slide deck. But on our website, we have a link to the STRTP curriculum that was created by the Reproductive Health Equity Project and released. We have a full webinar that talks through those resources, and you can actually email the National Center for Youth Law directly, or if you email me, I'll put my email on the next slide because everyone who has questions and we want to follow up after this, I can get started on those follow-ups. But you just have to email and you can get a free copy of the curriculum from the National Center for Youth Law, and also how to do that and the online curriculum link. So there's two, sorry, let me be really clear here. There's an online curriculum that is a link that you sign up, register, and take at your own pace. And when you complete it, you can request a certificate. And then there's a classroom curriculum, a train the trainer curriculum that they have where you can ask for that curriculum and use it internally and use those materials yourself. So we have that link on our website. All right. Is there a way to get access to the care coordination form filled out by schools for case managers to ask data about the sexual health education classes? Would love to see a copy of this form to bring back to my own county. That's a great question. So I know that LA has figured out a form. I think another county, Simone, I'm trying to remember how many, if you know any other counties that have an official kind of form, but I know at least one county has done this. We're thinking, yes, we would love for people to take this back to their counties and start this practice. It's going to speed things up and reduce some kind of unnecessary back and forth time. So let me get you a copy of that form, and hopefully you can work from there on how to set up that protocol. Any links for online trainings? Yes, the links for the online trainings are on our website under resources. And the next question, so this might be a good one for Alyssa and Gina. What advice would you give to CASA volunteers who work with foster youth?
That's a great question. I love CASAs, so thank you for volunteering. I think it's just really important to be honest and open and engage in some of these conversations. I think clients often don't know who to go to, and one of the main purposes of the CASA role is to be that natural support for them and to be an honest, open, trusting adult for them. So slowly maybe start to initiate some conversations and maybe make them very general, like, have you had sexual health education at school? Do you have any follow-up questions about that? Do you have people in your life you're willing to talk to about it if something comes up? So I would just be really, really honest with them.
Thank you. We've got a couple of comments that from the Q&A that I'm gonna put into the chat, because this is a resource that people can use. So Lydia Carlton from Planned Parenthood has said, we really focus almost entirely on this population. So please be in touch if you're trying to offer a similar type of program within your program. And then Health Connected is letting us know that they have free training, and I'm going to put their free training link and email to how to contact those educators right into the chat here. So thank you for providing that free comprehensive health education training. One question here is that the requirement that youth be provided with private storage space for their sexual health, reproductive health meds and products seems to be a challenge for many STRTPs. Many don't seem to know how or understand this requirement. So that is actually something that some of our STRTPs worked on in the learning community, was complying with the right to personal belongings and storage. So the way that one facility improved their protocol was they actually have a secure lock box that they sign out to the youth, that the youth can use to keep that their belongings stored securely in their room. And the locking feature is nice because it adds that protection, like it's just for that young person, it's not medication for anyone else, and they kind of monitor that. Now, a lot of these kind of in the moment, like prudent parenting decisions or other kind of management decisions, are made by one staff at the organization. And as long as they know like the rules and the rights about having your belongings on person and maintaining those, if for any reason a youth is not really able to personally self-administer medications or kind of keep on track with that, that person can then act as a staff lead and help parent and serve that youth in that way to really have it be safe practice. There's also some rules around essentially like search and seizure of items and having it be reasonable. So again, there is an ability to look if you have a real concern that something is wrong. But I think having that protocol laid out really clearly helps to kind of relieve staff of kind of those kind of dueling in practice in the moment conflicts that can come up. So we've got some really good practices to draw on there if you want to learn more from our partners who are dealing with how to balance that oversight with personal rights. We are at 2:30. There are, I'm going to put, we've got the link to the CalSPEC online training. You know what, I do want to say that our key to compliance guide has an appendix that has pretty much all of these resources people have mentioned. Appendix A is a checklist of the policy and procedures. Appendix B is really a list of the different 26 items that are of huge benefit if you're trying to implement this work. It includes the rosters, the LGBT Center link statewide, the CCLD and CDSS manuals that went out. It's got all of those links active. So it's kind of, we try to make it all in one place for you. So you don't have to kind of go back to the chat here. So that's kind of your core document with today's report. So we'll include that in the email out. And I don't know, Simone, if you want to say anything. I just want to personally thank our learning community members for the amazing work that happened, to Alyssa and Gina for speaking with us, and to the rep team for making this work possible. Figuring out how to uphold the rights of youth in real life is such a wonderful privilege as support staff, as educators, to be able to do this work. So thank you all. And Simone, do you want to say anything before we close out the webinar?
Just echo your appreciation for everyone who participated in the learning community, and also just thanks for everyone who joined today and participated.
Great. Thank you, everyone. Enjoy the rest of your day.